Welcome and good evening. Thank you for joining us for Managing Chemotherapy Side Effects. My name is Michelle Zapata, and I'm the program coordinator here at Waterford Place Cancer Resource Center. Waterford Place provides programs and services free of charge for anyone impacted by a cancer diagnosis that support whole person care. I'm pleased to introduce our speaker this evening. We have Jeanne Oelerich. She's a nurse practitioner at Rush Copley Cancer Center. So Jeanne has been an oncology hematology nurse practitioner for 20 years. She specializes in educating patients and families on treatment plans. And in addition, she manages side effects and offers supportive care throughout their chemotherapy treatments. At this time, I'm going to let Jeanne begin her presentation.
Very good. Thank you, Michelle, and thank you everyone for joining this evening. I really appreciate everybody being here and seeing faces, and I do look forward to the questions at the end, if you have any after we finish. And thank you again for technology and for being able to get everybody together this evening. I think that's fabulous. So hopefully we will make this very informative for you and helpful for you. I believe I have taught several of you in person, so you may be hearing some of these things over again for a second time, or possibly even more than that. So, but again, with this, we're going to be covering probably more of the common side effects of chemotherapy, obviously management of those side effects as well. And then at the end, if there's a side effect that you have a certain question about, something that is personal to you, or you just want more information on, definitely feel free to ask that at the end, and we can maybe talk about that a little bit too, and we can talk about the management of that. But for tonight, we're going to be covering pretty much more of the most common ones that we typically see. So with that, we will move my slides. Let's see. Why are they not?
Jeanne, there should be at the bottom left 2 arrows that'll allow you to switch. Or actually, I see it on the right side of your screen.
Oh, I see.
There we go.
Okay, thank you. Oh, very good. Oh, thank you. Okay, so chemotherapy, you know, when we think about this word, we just think of the overall like umbrella term of any type of chemical or medication or drug that is used to treat, or ideally to destroy and kill cancer cells. And so we know that the whole purpose of using these medications is to stop the growth of cancer cells, or potentially just even slow the growth of the cancer cells. These are cells that, much like some of our normal cells in our body that rapidly replicate and grow, cancer cells grow and divide very, very quickly. And the one good thing about that is that because of the fact that they replicate so quickly, they are more prone, or they have more of a desire to pull these medications up into them, which is good because we want that chemotherapy to get into those cancer cells to actually kill them. So when we say the word chemotherapy, it could mean the traditional, or what I call old school chemotherapy medications that work by looking for those fast growing cancer cells, but it could also mean some of the more of the targeted type medications that are used nowadays. We have these monoclonal antibodies, we have immunotherapy that you see on TV with drugs like Opdivo and Keytruda. We also use the term chemotherapy to refer to hormone treatments, like for prostate cancer or for breast cancer, endocrine type treatments. So that term is just the umbrella term that we use to say these are the medications that we use to actually kill those cancer cells. So the majority of chemotherapy can work all throughout the whole body, but usually doesn't cross over into the brain. The brain has a lining around it that prevents most chemotherapy from going into the brain, but there are certain chemotherapy medicines that can actually cross over into the brain and can actually have some effect on cancer cells inside the brain as well. So these chemotherapy, we know it can affect not only the fast-growing cancer cells, but where the side effects come in, as you can see here, they can affect the fast-growing healthy cells. And so when we think about fast-growing healthy cells or normal cells in our body, those are the cells that are made in the bone marrow, like your white blood cells, your hair follicles, the cells that line the mouth all the way down to the stomach and all the way into the intestines and out the other end. Those cells are all very quickly replicating, and so it can have an effect, usually a negative effect, and that's where this, like I said, the side effects come in on those healthy cells as well. So we know chemotherapy, every chemo is different. Potentially some of them have more severe side effects than others, and they affect people in different ways. Every person is different and every regimen is different, and some people maybe won't see as many side effects or the severity of them as other people potentially. And the good news is that we have lots of tricks up our sleeve for treating these side effects. Ideally, if we can prevent them, we will use those tricks too. And so those are the things that we're going to actually talk about tonight too, with management of those. And also, once the chemotherapy is finished, usually the further and further that gets in the rearview mirror, most of the chemotherapy side effects do improve, and hopefully some will go away altogether. So we are going to jump in now and start talking about the side effects. And so I would probably say the most common side effect for any cancer treatment, and that includes chemotherapy, but also radiation therapy, even post for like surgical and following a surgery, is fatigue. And so really this is something that the majority of our patients are all going to experience from one degree to another, maybe mild with certain treatments like the immunotherapy treatments, but then it can be also very moderate or severe with some of the traditional chemotherapy medicines. And this is a type of fatigue that is different than other fatigue that's not related to chemo. And so I always tell my patients it's more of a stamina type of fatigue where you just have a lack of energy, where with other types of fatigue, a person could maybe take a power nap or go to sleep at night and wake up feeling refreshed. Sometimes with chemotherapy fatigue, that just doesn't happen. And so it's, we say, we always say, take your naps and do that type of thing, but a person may not find that this really relieves all of their fatigue. And a lot of my patients have different words for the way they describe feeling tired or worn out or weary. Oftentimes my patients will say they just feel overall like heavy. Their arms and their legs feel heavy from that. And I've heard that term oftentimes from my patients. And when we think about fatigue, we know that when it's related to chemo, it can be very short-lived. Acute type fatigue lasts for a little less than a month or so, but then there can be chronic fatigue that lasts longer than a month, maybe even upwards of 6 months or even longer after chemotherapy is done. And then some of our patients who are on continuous type treatments going in and out of different chemotherapies may find that they have some level of fatigue all the way through. So with that, we know that there are lots of other causes for fatigue too, and I listed several of them here. And as a practitioner, I have learned that anytime that I can control or manage any other cause for anemia, or I'm sorry, for fatigue, I try to do that. Because I know oftentimes if it's a chemo fatigue, you can't take the chemo away. You kind of have to stay on the chemo to keep things under control. But if I can control things like pain that can be very fatiguing, or I can help a person manage their anxiety or depression. I can look at their medications and say, maybe I can change those around a little bit if they're causing a lot of fatigue. Encourage somebody to make sure they're getting enough sleep at night and work with proper sleep etiquette. They're looking at their nutrition and their hydration and their exercise. Those types of things that we can try to modify making them better or resolving them. Things like anemia, if I have to give a transfusion or something like that. But anytime that we can go ahead and modify those or remove them altogether would hopefully help with a person's fatigue. So, I consider all of that when we're dealing with this side effect, because there's a lot of causes, and some of these things we can't fix um, altogether, but we do our best. So here are a few things that I like to with these as I go through each one, talk a little bit about some of the things that that you all can do to maybe help with this. And I'm sure some of these you're already thinking about and doing, and maybe we can share a few others that maybe we can give you a few other better ideas to do. So with fatigue, anything that you can do in order to group your the work that you're doing or the care that you're doing, or anything that you can kind of do to just kind of make things a little easier or efficient for you, that is definitely going to help. And like if you've got to go downstairs to do your laundry and you've got things that need to go down there, make one trip. And and just kind of be thinking about how you can kind of do some things to, again, streamline or be a little more efficient with what you're doing. If you know that you are more energetic in the morning, plan, ahead, schedule your activities then, so that then in the afternoon and the evening when you get a little more tired, you can just kick back and rest or take that nap that we talked about. But so just be always kind of thinking about how you can make things a little easier for you, and pace yourself. I know that's tough sometimes when you might be a list person and you have all these things you want to get done, and just to kind of be a little more realistic with, hey, I can maybe set my pace a little more slowly. Or I think even later on it says, I put on there, ask for help. So try to delegate and see if you've got friends or family that can help you if you need to get grocery shopping or to clean your house or walk your pet or whatever. I mean, there are so many, I'm sure, that would be very willing to help out. I've had patients tell me stories of how people have just come around them offering to help. And sometimes our friends and family, they mean well and they will offer to do certain things, but my patients have said to me, but that's not what I really want to have done. This other thing would really help me out. And I tell them, I said, well, then let them know that. Sometimes people, when they aren't the ones going through chemo, it's hard, I think, for our loved ones and our friends to totally know what you all need. I think they might think they have a right idea about what could be helpful to help you. But if you tell them more of what you're looking for, I think that would really go a long way. So ask for help, and remember that if the shoe was on the other foot, you would want to help them. So take that help if someone offers it to you. We talked a little bit on the last slide about making sure that you're sleeping well at night. And so, there are rules for napping and sleeping. We call them napping and sleeping etiquette. And so things like never take more than a 2-hour nap. If you're going to nap, don't nap too late in the day, because it will actually interfere with your sleep. When you're preparing to go to bed at night, in fact, I'm looking at the time right now, 6:45. Don't be on your computers and your phones and your iPads and all those blue light things too late in the evening. They say to stop those things an hour before you want to go to sleep in order to let the melatonin and the sleep hormones to start to increase. Maybe taking a warm shower. So dimming the lights in your room, reading instead of looking at your phone. So there's all types of different things that you can help with getting an adequate night's sleep. And so you can Google some of those tips and do that. Again, your energy level is always going to be compromised if you're not eating well, if you are malnourished, if you're dehydrated. Dehydration always causes a lower blood pressure. When people have a lower blood pressure, they're always going to feel more tired, lightheaded, woozy, maybe dizzy. So that is so important. We are fortunate to have a dietitian that works at the Rush Copley Cancer Center. And so if there's ever questions regarding that, we'll talk a little bit more later on about appetite, and we'll discuss some things there, but we can always incorporate her into your care. Exercise and being active, even if it's a 5-minute walk around inside the house or walking down your driveway and back again, sitting and getting some fresh air, any way that you can be more active is always going to increase your energy level and help to decrease fatigue. So that is so, so very important. There's a lot of research on exercise, especially during chemotherapy. So, and then we do actually have some medications that we can prescribe if someone is really needing help with fatigue. And so you can always talk with me, talk with the doc about medications. Some of the ones that we use, we can do a little low dose of dexamethasone, which helps with nausea. I think most of you are familiar with that medication, and some of you probably take that medication. And it does kind of give a little bit of a boost in energy level. We don't like to keep people on that for too long, but temporarily using it is fine. We also know that we have medications like Ritalin and Provigil and things like that. So if I know I've had patients where they have a big event coming up and they have to have a good energy level for a wedding, or I just had a patient who celebrated their 60th birthday and he knew there were going to be a big party and lots of people, and so he's somebody who actually takes a little Ritalin now and again, and he's just like he said, it made my whole day. I was the life of the party. So I said that's great. So just so you know, there are things that we can use. Anytime we can use different techniques without medication, we prefer that. But if we have to, we have a few other, as I say, tricks up our sleeves. So we're going to move on and talk about nausea and vomiting. Definitely a side effect that can be distressing. I know when I talk with patients initially and they hear about chemo, they think right away, oh, I don't want to be thrown up. That scares them or causes a lot of distress when they think about the fact that they could potentially have this as a significant side effect. The great news is I share with them immediately that things are different now, and we have so many better and more effective medications to prevent nausea and vomiting and treat it if we have to. But this is a very different day and age now with chemotherapy, nausea, and vomiting. So nausea, I put a brief definition here. This is when you feel like you're going to throw up. I usually say when everything on the inside suddenly feels like it wants to be on the outside, that is definitely nausea. And I tell people that if you have the nausea medicine at home, that if you have that feeling, in order to prevent you from throwing up and from vomiting, that's when I usually say go ahead and start or take the nausea medication. And I know that we take this very seriously. And our cancer center, our infusion nurses are the ones that do a lot of educating on these medications, especially the ones that they're giving to our patients on the actual chemo day for prevention. Usually we use many different types of medications that work in different ways to prevent nausea, as well as prescribe the medications for when you go home. So that way you know how to take those, if they're for preventing or for managing. And the good thing for us as clinicians is we actually have guidelines that we follow that tell us, based on the chemo regimen, what is the likelihood that this regimen is going to cause little nausea, intermediate nausea, or a lot of nausea. And that's where our oncology certified pharmacist then builds these treatment plans and builds into those treatment plans all the proper medicines for nausea prevention and treatment. So, it's kind of an algorithm type of thing that we get to follow. And most times those work just fine, and other times we need to be a little more creative and add in some different medications. We start with some to begin with, and then if those aren't working so great, then we switch or we add in and have our patients altering nausea medications to kind of help with that. There are other ones that are newer and on the market, so we can add those in. Sometimes it is like a motion sickness or vertigo type of thing that makes people feel a little nauseated. And so sometimes we can use some of the medications that people might use, like Dramamine or something like that, to help with nausea treatment. And so yeah, so we do, like I said, we take this very, very seriously. And if even someone has a rough cycle with nausea and vomiting, if that's initially when they start, we always tell them we can add more to it and we can work with that. Typically, we like to use the medications that have an FDA approval for nausea and vomiting. And we get asked all the time, this probably won't be the first time I bring this up in our talk tonight, but we do get asked about medical marijuana now, because now everybody wants to use that for everything. And I do have, at least anecdotally, some evidence that our patients do, if nothing else is working for them, and they then try an edible. We never want our patients smoking marijuana for obvious reasons. We don't want anybody with cancer putting anything in their lungs that shouldn't be in there. And so if it's an edible or a gummy or whatever they make these days, I've had patients say that nothing else worked for them, but that did help them. So we can always talk to our patients about that as well. It's not the first thing that we like to jump at. And thankfully, most of the medications that we have now that are FDA approved work so well that we don't usually have to go that route. And then looking at this, these are some other little tips that I like to cover with our patients. We've talked a lot about the different medications that we could go ahead and prescribe. And then you can see a number of different things listed here. So one thing is, we know that when the stomach gets empty, if a person isn't eating regularly, the acid in the stomach can increase, and especially when people are on chemo, because as we're writing chemotherapy, we're causing the body to be physically stressed. We sometimes, well, oftentimes cause mental stress too with it, but definitely a physical stress on the body that is going to increase the production of acid. And when that stomach gets empty, if there's not food in there, some type of a little snack or some hydration in there, oftentimes then that acid builds up, and that a patient can experience reflux or heartburn with that, and that can definitely increase nausea. So I usually tell people to eat small snacks, small meals, little snacks all day long. You know, if there's diabetes and kind of in the mix with this, sometimes it's a little harder, but there's lots of good protein snacks and things like that that a person could add in. Otherwise, I really tell my patients that from a nutrition standpoint too, that you should be eating small meals and snacks all day long anyway. And so it kind of helps, obviously, with keeping your calorie intake up, but it also helps to hopefully prevent nausea. And when it comes to those snacks, some of my patients love the ginger candies or ginger cookies and things like that. And so that if that works for drinking ginger ale, that's good. So anything like that that might come in handy. If you're drinking things that are too hot or too cold, sometimes that can cause some cramping in the stomach as well, and cause some nausea. Avoiding strong smells, and sometimes that is when someone is cooking and it's just the aroma of food that's cooking that can make a person feel a little nauseated. And if that's the case, getting some fresh air, avoiding strong smells like perfume or bathroom sprays or cleaners. Sometimes people say that that can really make them feel a little nauseated. So just really trying to avoid that. Getting some fresh air definitely can help. eating mints, or sucking on hard candies, or popsicles. Again, the ginger candies, people say that those really help them. So anything like that that can just kind of change the taste in your mouth. What am I thinking of? Oh, essential oil. Some people will actually use like a peppermint oil, and they'll just drop a drop of peppermint oil into water or something like that, and they'll drink that to kind of settle the stomach as well. And we know that caffeine in coffee and in tea, especially on an empty stomach, definitely can cause nausea. And cigarette smoking, when someone smokes, they actually swallow some of that nicotine and some of those chemicals, and that can really irritate the stomach too. So hopefully these are some tips that you guys will find to be helpful with preventing that. I want one last thing I didn't mention was like when we're in the middle of chemotherapy, either coming in the day of or you go home that night, to really just be mindful too of like what you're putting in your stomach from a standpoint of maybe nothing that's greasy or deep fried or really spicy foods, things like that around the time of chemotherapy might upset the stomach. And I say that, and then I have some patients that can eat anything and everything. And they're the ones that leave the clinic on chemo day and go get pizza or tacos or whatever they eat, and they do just fine. So, but if you know that kind of aggravates you, then maybe more bland foods, things like that would be probably a little less aggravating. So now we're going to switch gears and we're going to talk about, I would say, probably the most distressing side effect for my patients, at least from the angle of them thinking about side effects. Most of my patients, after doing this for almost a quarter of a century here, tell me this is the most distressing side effect to think about. But once it happens, it's the one that they don't really seem to be so bothered by. It actually is more distressing for them to imagine this coming than actually going through it. Not to minimize at all the process of when that happens, because I have heard plenty of stories and how that all goes down for patients. But I love to share with my patients when I'm sitting initially in our first teaching that the thought of this ends up being more distressing than when it actually gets here, and then once they move on from that. So hopefully y'all can relate with that a little bit and agree with me on that. We are fortunate to know that some treatments don't cause a person to lose their hair, and certain regimens, and certainly some of these targeted therapies that are out there and these immune therapies, those medications, those chemotherapies are not causing hair loss. The traditional chemotherapy that we talked about, just with the way that it affects those fast growing cells, that really, those are the medicines that are still causing hair loss. Because again, it has to do with those hair follicles and the cells that make up those hair follicles being very rapid growing cells. And so the hair loss can happen definitely on the scalp. It can happen with facial hair. So for guys who are growing a beard and mustaches, definitely eyelashes and eyebrows at times. The little hairs inside the nose, those go oftentimes. And so people always say, why does my nose run all the time? And I say, because you lost the hair in your nose, and those little hairs in your nose are the things that keep your nose from running all the time. And so that's one thing that they don't really think about, like, oh wow, I didn't realize I lose the hair inside my nose, and those little hairs come in handy for lots of different things. So so really, I mean, anywhere, some chemotherapy is a slow thinning of hair that we see with chemotherapies, and that can occur over a number of weeks. Certain treatments just change the hair a little bit, maybe just make it thinner overall, but a person still keeps a good amount of hair, or even it can change like the texture of the hair, or that's probably a good word, the texture of it, or the color, or the coarseness of the hair. And then certain chemotherapies, we know that when we give that chemotherapy within about 2.5 to 3 weeks, we know that someone will be having to make that decision on whether they are trimming their hair very short, choosing some wigs, some scarves, hats, things like that. So some chemotherapies, that's exactly, and we can almost to the day tell our patients when they're going to start to notice a thorough loss of their hair. Sometimes it's a little patchy, and let's see let's talk a little bit. So when a person loses their hair, people ask all the time, is it going to hurt? Am I going to feel anything different? And we don't typically, our patients usually say maybe a little tingling to kind of let someone know that that's coming, but usually there's not any discomfort to the scalp. Usually there isn't anything that's really seen on the skin or anything like that. But I always tell my patients that if they're going to choose to get a buzz cut, and a lot of times it's their sons or their husbands, or I've had patients with their brothers that know how to use those little trimmers, and they'll be the ones trimming them, or their hairdresser. I always say to go ahead and leave a good 1/2 inch to 1 inch on the scalp. Never buzz cut it all the way down to the skin, because I don't want the skin to get irritated. It could potentially have a little bit of infection in the hair follicles if it's cut too close to the skin. Most guys would tell me it's the number 2 on their little hair trimmer. So that's usually what I tell my patients. Once the chemotherapy that's causing the hair loss stops, about 1.5 months after that last chemotherapy, so about 6 weeks later, that is when the hair will start to grow back in. And so eyelashes and eyebrows and things like that come back pretty quickly. And then the scalp hair, about 1/2 inch a month or so is the usual regrowth pace for most people. And the hair that I refer to as chemo hair is typically different when it grows back in. It can come back in with a more of a curl to it. If someone was maybe starting to go gray, it might come back in a little more gray. Usually I tell people more pepper than salt, so it's maybe a little darker, but that usually starts about 6 weeks after, and then it just kind of keeps growing in. And people ask all the time, am I going to keep the curl? Am I going to keep that? And most times people do not keep that chemo hair, because our hair, all of our hair has a lifespan to it. And it's the reason why we're always losing hair, and we're getting new hair filling in. And so depending on the lifespan of that chemo hair, and as new hair, the second growth is coming in, that chemo hair is going to eventually fall out. And usually people go right back to what they had prior to chemotherapy. So every now and again, I get a person who will keep some wave or some curl, and they usually like that, especially if they had real straight hair beforehand. So, okay. All right, here is, okay, so we talked a little bit about this already. So shaving your head, cutting it short. Good idea if someone does know that they want a wig, to go ahead and pick something before they lose their hair, especially if they want, well, I guess in this day and age when everybody has cell phones with cameras on it, it's a little different. But I remember the day that if someone really wanted to have a wig close to their hair, they'd have to bring a picture in and all of that, or go in before they lost their hair so they could pick a wig that looked similar. Some people, they just want completely opposite of what they have. So they go a little crazy with different color wigs and all sorts of fun things. So very important to protect your scalp, keep it moisturized, using something like Head and Shoulders shampoo on the hair as chemotherapy is starting, or even using that on the scalp is just fine. Keeping your head from burning, especially as now we're going into the warmer months, and obviously keeping it warm during the winter. And I always tell people, put bug spray. Like you don't want to give mosquito bites up there. And so people don't really think about that in the summer. I'm like, no, you got to put bug spray on there too. So one of the things that I get questions about every now and again is these cooling caps. So it's referred to as scalp hypothermia treatment. And this really is meant for preventing hair loss. And what they've come a long way with the different machines and instruments that are used to do this. However, it's not anything that I would probably say, in my opinion, has arrived 100%. They're getting better at preventing hair loss, but it is quite a process to do this. These machines have to be rented through different companies. They are then brought in to the infusion room on the day of treatment. It's a pretty big machine. Sometimes a company will send a technician with the machine to the cancer center. Sometimes the patient, they actually rent the machine and they actually have to haul it with them and bring it with them into the cancer center. The one thing we know about this is actually a cap that is worn during the entire chemotherapy process, sometimes or even afterwards, and they lay out the whole schedule for all of that. But it is below freezing. I mean, it's that cold, and it is meant to close the blood supply to the skin of the scalp, so that chemotherapy that goes everywhere through the bloodstream, for the most part, going through the skin and going to the scalp, that chemo will not go into the scalp area, because the blood vessels are constricted and cold. Now, you can imagine that if you've ever had an ice, we've all put ice probably on some areas, but covering your whole head in a big old ice block of like a ice pack, headaches, it's just cold. I mean, our patients they're usually complaining of feeling really cold. They can get neck and shoulder cramping from that. In my opinion, they can work really well for some chemotherapies if those chemos are not really harsh and cause a lot of alopecia or hair loss. But for some of the regimens where we just know they have a high rate of hair loss, oftentimes I've seen patients where they maintain some of their hair, but it can be still very patchy or very thin. And so, like I said, I think the majority of us as clinicians still have yet to really jump on board for that. And I think when we talk to our patients about that and we direct them to some of the different instruments or companies that make them and market them, they do their own research, and most of our patients decide it's a bit more hassle than it's worth. So, but we can, if anybody has questions about that, we can talk about that. I think we've only had one patient ever at Copley who brought in their machine, had that brought in and did that, but we don't see that too often. We're gonna move on and talk about appetite. So this is a big deal. We know that eating and our appetite it's a quality of life thing, and most of us, we like to eat. And so when we are on chemotherapy and we know that our appetite is changing, most times chemotherapy causes a decrease in appetite, and that's what I'm going to mainly talk about that here. Every now and again, there are medications, though, that will increase your appetite. Some of these nausea medicines, like the steroid dexamethasone, that a lot of you may be on, people say that really boosts their appetite and they're eating lots more than they want. And I have some of my patients who they don't want to be eating all of that and gaining all that weight. But for this talk tonight, we're going to talk about when our appetite decreases from chemotherapy. And that's really the more likely thing that happens. And we use a medical term for decreased appetite. We say that's anorexia. And so definitely related to chemo. We know that some of our patients can have appetite changes just as a result of their cancer, a symptom of their cancer. We know that cancer can release chemicals that decrease a person's appetite. So this can be described as, a patient just doesn't feel hungry. They can go all day long and not have any desire to eat, or they can just have no cravings, no taste for anything. I ask my patients all the time, if you went, could you go through a whole day and not even think about eating? If they say yes, I'm like, well, that's definitely affecting their appetite. Or I ask them, does your stomach growl? Do you ever hear your stomach growl? Do you ever get hungry? And sometimes my patients will say, no, I really don't. Well, that is definitely decreased appetite. And so certainly we know that if a person's experiencing nausea, that's going to cause their appetite to be decreased. Any of the chemotherapy medications have the potential to do that. We know that certain other medications can do that, from some pain meds to some meds for heart and blood pressure and things like that. So I always like to try to look through and see what medications my patients are on and how that could be affecting that. If a person is tired, they're not going to feel like eating. Certainly patients who are having mouth sores or sores in their throat, my patients that are receiving radiation to the tonsils or to the mouth or to the throat, they definitely have sores or a soreness in there, and they certainly have no desire or taste for any food. We know mood can make a person lose their appetite. Anxiety or feeling depressed can definitely change that. And we know that if a person is not eating the amount of food that they should be eating, and they are malnourished, that certainly is going to cause them to be more tired, to feel more weak. They're going to see a weight loss on the scale. We're also going to see a loss in their muscle mass. And so this is just kind of the spiral effect of if a person isn't eating enough and they are losing weight, then they're going to feel weaker. Then they're not going to want to move or exercise as much. And then without exercising and moving around so much, the appetite's going to go down even further. So it's kind of that vicious cycle. And we always try to reverse that. So nutrition, having a good appetite, is so important, because as we are beating up all the bad cells and killing the cancer cells, which we want to do, we know, as I've mentioned before, that we're also killing some of those healthy cells. And the way that a person rebuilds back those healthy cells is with good nutrition. So very, very important that we keep you eating and give you lots of good tips on how we can help with that. So here are some tips. I hope that some of you are already doing these things, and we'll kind of go through a few of these here. So I talked a lot about these little small meals and snacking, and if and to actually schedule them and to not wait to be hungry, because if you're waiting to be hungry and you're not getting hungry, you're never going to eat anything. And so sometimes it just is just a regimen of booking in these snacks. I always say, get your biggest bang for your buck. So if you can pick certain foods, if they are small quantity and they pack a big punch with a lot of calories and protein and fat, then that's really going to help you, because you are going to keep kind of snacking. I always say, eat like a toddler. So pick yourself up like just little finger foods of like cheese and crackers, and maybe those peanut butter crackers, or pudding cups, or the small little protein shakes. Whey protein powder is a great powder that you could pick up and throw into a yogurt or a smoothie, things like that. So things that are really going to give you, in a small amount, a large amount of protein and calories and fat are really, really good. So I'm never opposed to somebody grabbing a few little mini Snicker bars or payday bar, because paydays, they have nuts in them, and or even some of the just like your walnuts and your cashews and things like that. So anything like that can be really helpful. The small little packs of tuna salad or tuna or salmon, making some egg salad. That's got a lot of protein in there. A good range to kind of aim for protein is somewhere around 100 grams of protein a day. And I know the majority of us, I don't think we eat 100 grams of protein a day, but you on treatment, very, very important that you aim for that. And for calories, this is a large amount of calories, but we should be aiming for around 2,000 calories a day. And I probably can imagine that the majority of my patients don't eat anywhere near that. And so those two things, if you could aim for those, that would help you. And really, making the milkshakes, like I said, and things like that, anything or any of those protein shakes that are on the market, from Muscle Milk to Ensure or Boost or Carnation breakfast drink. If you have to watch sugars, there are the diabetic shakes like Glucerna, those types of things. Any of those would be really good to go ahead. I had a patient tell me or teach me so many years ago, I can't even remember how long ago it's been now, but he lived on something called Mushy Joe's. And I share this with my patients. And what a Mushy Joe is kind of like your the barbecue sloppy joes. It's like that, but without the tomato barbecue sauce thing that can sometimes kind of cause a little bit of heartburn and whatnot. A mushy joe is a little different because you're still using ground beef or ground turkey or whatever meat you want to brown up in it, but then you throw in there cream of mushroom soup, which has a lot of fat and a lot of calories. And of course, the meat has your protein. And so you've already browned your ground beef, and then you're throwing on your mushroom soup. You're warming that all up. And then you can put that over mashed potatoes or buttered noodles, or even on a bun, and eat it like you would a sloppy joe. So that is a lot of calories and a lot of fat and protein in this small little thing. My dad ate them all. We made that for my father for a whole year of his life. So to try to get him to gain weight after a surgery. So those came in handy for him. But the other thing too, with eating and trying to get you to improve your appetite, is changing up your routine. And sometimes it's, if you eat by yourself, you're not gonna, nobody likes to eat by themselves. It's hard to cook for one. It's hard to eat all by yourself. So if you can mix that up a little bit and, eat with friends or family, or change up your routine, or even call somebody on the phone while you're eating and you're kind of sharing a dinner or a snack with them. We talked before about avoiding any smells, like the hot versus cold smells. Hot food by nature is more aromatic and puts off more odors than cold foods. So I know a number of you have told me that cold foods just go down easier, fruit and smoothies and things like that. And sometimes those warm foods, I've had patients even tell me just the fact that they just smell the food cooking is enough sometimes to fill them up. And so maybe not exposing yourself to the aroma of the hot food until it's actually time to eat. So I've had people tell me that a lot. The metallic taste from chemotherapy can make people have not so great of an appetite. And so using plasticware or cooking in glass, and not, maybe don't drinking out of cans or anything like that. And then we did mention our dietitian before, but Michelle Cordes is our dietitian that works with us through Rush Copley. I put her business card always in our teaching folders, and include a brochure from the American Cancer Society with helpful tips. If you don't have that, or you've not met Michelle and you'd like to, definitely see me or talk with anybody at the front desk, and they can go ahead and get you connected to Michelle, and she's more than willing to have you email her questions or call her. She does phone consults. And she's always in our clinic on Thursdays. So if you need to get a hold of her, and it is no charge to you at all. I mean, her services, you can just utilize her however you need for any tips on that. So, and then really the exercise, remember, the more active you are, the more your appetite could be improved. So we really would hope that that would help as well. There are some medications that can stimulate appetite. We use them sparingly. They can have some side effects, but if this is really a big issue for a patient, then sometimes we just really need to kind of pull those out, and we can use those temporarily to kind of boost the appetite and kind of get things going. This is also another reason why my patients will use the edibles, medical marijuana, and or even, I should have mentioned before, with nausea, CBD oil, which is that part of that plant that isn't the THC part that gets people, I guess, a little high. But CBD oil, if that seems to help an appetite, we are never opposed to that, because that does not interact with anything that we're giving you. So you could always try that, or talk with us about some of the other medications. So we have that for options as well. The next two things we're going to talk about is we're going to talk about your bowel movements. And patients on chemotherapy, we know that they sometimes can be thrown off. Sometimes things slow up, and we call that constipation. Sometimes things get moving a lot more quickly than usual, and that we're going to talk about next, diarrhea. But this is definitely when constipation is when you're not having the normal number of bowel movements that you're accustomed to having, or they are definitely harder. Things are more difficult to pass. Maybe you're uncomfortable with bloating or cramping. We know that constipation can definitely cause a person to have nausea. If things aren't moving out at the usual pace, the stomach can definitely feel nausea. And if people have vomiting from being severely constipated. And there's a lot of different causes that our patients have for this. Just the chemotherapy alone oftentimes can do that. The nausea medications that we use, usually the ones that we give in the clinic on the day of treatment, are the ones that cause this. And most of those medicines are out of the system within about 3 days or so. So I usually tell people, be on the lookout for constipation early in each of the chemotherapy cycles, because we more likely are going to cause that up front, and then potentially the loose a week later or so, but we'll talk about that in a second. So we know that if a person is dehydrated, if they're not getting enough fiber, if they're not walking or exercising enough, any pain medications like narcotics can definitely cause constipation. Anesthesia or after surgery, our patients can be constipated. So lots of different reasons for this. Everybody's got kind of their own normal pattern. Usually we say if a person hasn't had a bowel movement in 2 days, they should call us, or they should be taking something for that. And so if a person wants to keep a record of kind of how this is going, then you kind of get a better picture of, oh yeah, look at these first 3 days, this happened. But then after I got to a week after chemotherapy, then it was back to normal or whatever. So it's always helpful if you want to take a few notes on this. Definitely staying hydrated. That in itself is going to be in your favor. With water, certainly I've had patients that like to warm up things like prune juice or nectarine juice. There are senna teas that people drink to kind of get things moving. Even when they use things like laxatives like Miralax, people have told me that they will use warm water with their Miralax, and that seems like that kind of helps. So definitely staying hydrated, getting enough fiber, whether that is with vegetables and fruits and grains, or taking a fiber supplement like Metamucil or Citracal or something like that can definitely help. The more active a person is, usually the more regular they're going to be. So I always say again, there's another, reason for exercise. Exercise helps you sleep better, it boosts your appetite, it helps you poop. So that's a lot of good tips or a lot of good help with exercising. And if a person does need to be on something to keep them going regularly, we can use all three of these different things. We can put them on fiber supplements. We can use stool softeners or laxatives if they really need help going or moving. So any of those can be used, and you can definitely talk with me about that or your doctors about any of those things. And all of those things are over the counter. If you have any questions on how to use that, you can always give a call into our phone nurse or talk with me too. So the opposite of that is when a person they're going more frequently than when they would normally go. And so you know your schedule, you know how often you usually go. And if things are more frequent, or if the consistency of the stool is now changed, where it's looser or even watery, that is considered diarrhea. And again, you can see so many different causes here, from medications to infections, definitely antibiotics. This is where we need to hydrate you. So drinking your Gatorade, juices, water. Apple juice makes a person have diarrhea, so we always say avoid apple juice if you're having this. And really following this brat diet, bananas and rice and applesauce, toast and tea, and really a low fiber diet, a bland diet, avoiding milk products. When you are having diarrhea, your gut is immediately lactose intolerant, so avoiding that. And if you are having diarrhea for more than a day, we really need to know that, because we might have to hydrate you or replenish your electrolytes like potassium or magnesium. And there are over-the-counter medications for diarrhea treatment, Modium, and there's also prescription medications that we can write as well that are a little more powerful. So if you need those, we can definitely do that. So this is the last topic that I'm going to talk about, probably the most serious though, and this is the whole idea of the risk for infection when someone is on chemotherapy. The whole idea that someone could get sick from different germs that could enter in any different means, and that would be in any type of infection: skin infection, respiratory, colon infection, urinary tract infection. And so anyone that has cancer, and definitely if they're on chemotherapy or radiation, they are at risk for infection. We know that chemo decreases your white blood cells. They are the ones that keep you from getting sick and fight the infection if you do get sick. The blood cell I always talk with you about are the neutrophils. That's a specific white blood cell. And when that neutrophil count is low, we call that neutropenia. And when that count is at its lowest point in the chemotherapy cycle, we call that the nadir, NADIR, the nadir. That's the lowest point of where a person might fall during their chemotherapy cycle. So I know I beat this up a lot, but I'm always telling people, look out for fevers, look out for chills, all these other different signs, sore throat or a new cough or burning when a person urinates or having abdominal pain, anything like that, a redness of the skin, anything like that could be a sign of infection. So you should let your doctor let me know that right away. Fever or chills, and you can see here 100.5 degrees or higher, especially if there's chilling with that, is the most serious sign that you could potentially have an infection, and we would have to treat that. So here are some ways that you can actually prevent that. And I feel like I don't have to maybe beat this up so much, since we are still in the midst of COVID, and we hear this every day of our lives, I'm sure: washing your hands and using your hand sanitizer and bleach sprays all over the place, avoiding crowds and people that are sick. Do not let people come to your home if they're not feeling well. Really maintaining good mouth care, brushing your teeth, a good mouthwash, taking good care of your skin with a moisturizer. Don't let your skin get cracked or dry. If you've got pets at home that you have to care for, being careful with that, and especially if it's a cat litter box, or if it's a pet that could potentially scratch or bite you, be very careful with that and let somebody know right away if something like that were to happen, um, because we would want to treat that infection. One very big thing to talk about is when our patients are receiving chemotherapy, really watching the type of food, or the way that you care for your food. Never eating anything raw, like raw fish or seafood, raw meats or eggs. Cleaning up after you're using any of, or if you're preparing eggs, cleaning up the counter. Really not eating leftovers that have sat out. You want, that's my doggy. You want to make sure that you put leftovers immediately in the fridge, that you don't want those to sit out. I mean, even a few minutes on the counter, food left out can already start to grow bacteria that, when a person is on chemotherapy, could cause a little bit of GI upset, versus someone who maybe is not on chemo. So be very careful with that. We watch the white blood cell count. We use medications if we have to prevent the white blood cell count from dropping, or actually to raise up the white blood cell count if that is too low. So we will prescribe those types of medications. And if we need to put somebody on antibiotics, antiviral medications, antifungals, we always use those appropriately too. So very, very important that we keep our patients safe and that we prevent them from getting infections and managing those if they do actually get sick. So that, I believe, is it. That's a lot to go over in a very short time. So I will stop sharing this.